Good evening. Hard to believe it's now $1 billion bungle. That's the cost of the disastrous Queensland Health payroll. But despite the astronomical amount, a new report says we should keep it. State political editor Cathy Border is in Parliament. And Cathy, most people and patients would be absolutely gobsmacked.
That's right, Bill. $1 billion for a system still riddled with problems. And the stark warning is that even if we took the extreme action of junking it and starting all over again, it could actually make matters worse. There's been plan after plan to try to fix this. Remember when it first came in, we found out that there was no parallel or backup system operating. And the report today also finds there's still no money for a contingency plan. $1 billion would pay for 18,000 nurses for a year. It's also the cost of the new Children's Hospital in Brisbane. It started off as a health headache, and now the Minister says that the system is on life support. We knew it was a disaster, but the health payroll hit for taxpayers beggars belief. The KPMG review says it's cost us $1.253 billion plus, and the Health Minister says the Bligh government hid it.
56% of the basic payroll operating costs were unfunded in their last budget. That's a cost of $374.8 million hidden by Labor.
$1 billion is more than the GDP of Vanuatu, Samoa or St Kitts in the Caribbean. You could buy 3 A380 planes, 3 gateway bridges, the world's first $1 billion house in India, even this luxury liner with its own beach and helicopter pad.
These hundreds of millions of dollars should be available today to help sick Queenslanders.
The damning report says the system is still fragile. There's still no electronic rostering. It recommends changing the pay date. Annual leave continues to be botched. And 27 months on, there's still payslip confusion. More than 1,000 payroll workers struggle with 200,000 manual transactions every fortnight and have to file 92,000 forms. But KPMG warns against dumping the problem payroll altogether. There could be potentially significant negative drawbacks or consequences associated with adopting a new system. On top of all this, the system still has to be upgraded before 2014, with $25 million already allocated to look at that. KPMG says the government should ask the private sector for help. Now, the Health Minister, Lawrence Springborg, is joining us this evening. Minister, is scrapping the system altogether out of the question?
Well, it's fraught with real issues and real dangers if we do that, and regardless of whether we do or we don't, we're locked into this current contract and current system for the next 2.5 to 3 years, and it would take that long at least to get a new system up and going. And even if we did, we've still got the award complexities which cause so many problems for this and some of the back-end issues.
The payroll office, that's ballooned to over 1,000 people. Is that sustainable?
Well, it shouldn't be sustainable, but it's what we need to actually run a paper-based system that sees some 200,000 pieces of paper fiddled with each week to make 92,000 entries into the system. I mean, and this is the real problem. It's
could jobs go there?
Well, not in the short term, because we need that to sustain this system. But ultimately, if we put some of these other fixes in place, yes, we can reduce that over the next couple of years.
Can this system ever be fixed?
Well, that's the big question. And what I will be doing is going to open market with a request for information to see what ideas exist out there. We have an opportunity now with the new hospital boards to be able to look at other ways of delivering this. But whatever the case is, it'll take 2.5 to 3 years. We need to not repeat the mistakes of Labor.
Thank you so much. That's the Health Minister, Lawrence Springborg, joining us this evening. So there you go, Georgie. We've heard that the system has still got massive problems, and no doubt this is far from the end of the story.
Sounds like it. Thank you, Cathy Border.